Carney. Thank you for joining us today on our weekly press conference on Delaware's response to COVID-19. We're coming to you today over a Zoom connection. Most of you are familiar with that during this COVID-19 time where we communicate with one another through a Zoom sessions like this. I'm joined today again by Dr. Karyl Rattay, who's the director of the Division of Public Health, and she and her team has been working incredibly hard over the last 9 months, as you know, and she's been with us here on a weekly basis, as well as AJ Schall, who's the director of the Delaware Emergency Management Agency. He's been on the bench the last 14 days. We're delighted that he's coming off the bench and back in action. He has been working diligently during that period of time, and I'm coming off the bench as well, just having abided by some level of quarantining, recognizing the contact that we have on a regular basis, and just to be cautious about the possibility of spread. I and others in the office had a negative test and quarantined for that period of time, and we're delighted to be back in action. We have Pam, who's our sign language expert, who's with us each week as well. So thank you all for joining us. We have good news and some not so good news in our presentation today. And the good news is we'll be talking more about vaccines, the availability of vaccines. You've heard it on the national news, the availability of 2 vaccines that we expect to get emergency authorization any day now and be available here in our state within the next week or so, and we are working hard to identify priorities there for distribution and getting our distribution networks and plans all set, and Dr. Rattay is going to talk about that. So vaccine is a really good thing. These vaccines have been developed in record time. They're safe. They've gone through transparent and rigorous testing, and we'll get that kind of review from the FDA, and with any luck, the next couple of days, get the emergency approval that they need. Dr. Rattay is also going to talk about new guidelines around quarantining, which are being reviewed which have been released by the Centers for Disease Control and are being reviewed by Dr. Rattay and her medical staff at the Division of Public Health, and we'll have more about that today, and we'll hear more about that in the days and weeks to come. And then AJ's team, the testing team, has been doing an incredible job. In fact, they're testing so much that they're going beyond the ability almost of the labs to return the tests, and we have to strike the right balance there between just testing as much as we possibly can so folks can know their COVID-19 status and getting the kind of turnaround that we need from the testing labs so that people can know the results of their tests and take appropriate action. If you haven't signed up for our COVID-19 COVID Alert app, we continue to recommend folks to do that. We're getting tens of thousands of folks to do that. On the not so good news side, we've been telling you the last couple of weeks that the number of positive cases have been increasing, new cases on a day-to-day basis. Part of that is a function of the fact that we're doing the kind of testing that we are, maybe 5,000 to 10,000 tests in a given day, but the percent positive, so the percentage of those tests that are actually administered on a particular day are coming back positive. The World Health Organization goal there is for 5%. And less than 5%. And we, earlier in the summer, we were down for persons or for a test administered positive in the 2% and less range. And now we're approaching, on a 7-day moving average, as you'll see in a minute, 10%. So significantly above the 5% target, and much, much higher than it was just months ago. And most concerning, frankly, and we'll talk a little bit about that, is the rise in hospitalizations. From the early days back in the spring, I've been saying to all of you that that's that one indicator, the one criteria that we're very sure about. because the people at the hospitals, they count the folks. They know who's in their emergency room, who's in their critical care beds, who's in the hospitals being treated for COVID-19. They admit people and they're tested, and some are in a holding place, if you will, and then they're determined to be either a positive or a negative. And the number of COVID-19 individuals that are hospitalized in Delaware, as you'll see in a minute, has surpassed the peak that we reached back in the end of April, I think April 27th at 337. Today, the number, as you'll see in a minute, is 338. And those are real people in hospitals being treated for COVID-19. That's very concerning to us from the beginning. Protecting that hospital capacity has been one of our main priorities and objectives. And we'll talk a little bit all the actions that we've taken in the run-up back in March and April to that peak at the end of April were geared towards reducing the exposure and risk of folks coming in contact with somebody in the public who's carrying the COVID-19 virus, and then having that transmitted to you and becoming COVID-19 positive yourself. So you've got to limit that risk by limiting opportunities for that exposure. The more prevalent the virus is among people walking around in public, the greater the risk. And we're seeing many more people that are testing positive, which informs the decisions that we make to protect people, to protect health, protect other vulnerable citizens from COVID-19, and ultimately to protect and preserve that hospital capacity. So let's go right to the data dashboard and look at the number of cases. We're up to 41,000 cases since our first case back in March. We've lost, sadly, over 800 total Delawareans during those months. And as you can see there at the bottom, the hospitalization number now in Delaware hospitals, that's a real number as the others on the screen, 338. You'll remember me talking about our capacity that's somewhere in the 400 to 500 range, maybe a little bit more if we manage that capacity at the hospital level. 41 of those hospitalizations of the 338 are critical patients that are in critical condition. Among those total cases now, we've got 23,000, almost 24,000 positive cases in Newcastle County, 6,200, just a little bit over 6,200 in Kent County. And Kent County right now is where we're seeing the most hospitalizations as a percentage of the population, the highest increase in new positive cases, which is very concerning. Kent County hasn't had the testing rate that we've had in Newcastle County and Sussex County, and so that's a bit of a concern. But certainly the increase in positive cases across Kent County and the number of hospitalizations that we're seeing in Bay Health is a significant concern for all of us. And then in Sussex County, we're almost to 11,500 positive cases. Again, one of the, probably still the highest as a percentage of the total population there. So let's look at a couple of the measures that we look at. The percentage of persons tested, we're way up to 23% now. So some people have been tested more than once. These are individual Delawareans, some of which have been tested 2, 3, and 4 times. And then the percent of tests that are administered that are positive at almost 10% on a 7-day moving average. So even though we're doing significantly more testing, as I mentioned a minute ago, the percentage of those tests that are administered is almost 10% now. And so you can see that the prevalence of the virus in our community is significant, and we have significant community spread. Again, 730 new cases per day. If you think back to late August, early September, we were looking at maybe 100 cases per day with even still fairly robust testing at that time. And so we're 7 times that with these new numbers and significant spread across the state of Delaware. I would say that those numbers are a little bit lower in the lower county in Sussex County, which is a little different than what we've experienced going all the way back to April, where those Sussex County kind of always had the highest numbers. Again, the number of tests of persons that are tested, about almost 500,000 now, and almost 800,000 individual tests that have been administered, and in particular the last 2 months of October and November, the number of tests being administered has increased dramatically. In both cases, I think, AJ, you'll talk about this, over 100,000 in October and over 100,000 in November as well. And our goal was 80,000, which I thought we never had a chance of getting. So the rate of positive cases by demographic, there you can see all of the demographic areas are rising now. Since the beginning of November, we're starting to see the surge from the Thanksgiving holiday. And as I said, very concerning with those hospitalization rates. So looking at the data dashboard, you can see on the top far left graph there, the current hospitalization number at 338, gradually increasing through the month of November. And when you think about the number of new positive cases on a day-to-day basis now and for the last several weeks, we can expect that hospitalization number to continue to rise. In the middle, you can see the number of new admissions into the hospital, and that's pretty steady. Normally that had been trending down and at least up and down and somewhat episodic. New positive cases, again, the top row far right on the 14-day view, significantly higher than at any point during the last 9 months. And then on the bottom, persons testing positive in double digits now, almost over 20%, and then almost 10% on the 7-day moving average for the number of tests that are being administered and that are coming back positive. And as I talk to people, everybody I talk to now seems to know of somebody either in their own family, somebody individually, or somebody that they know and a close friend that has tested positive, and others that are being quarantined and that are worried about coming down with a significant a positive test as well. So if you look at the 90-day view, again, the top two, the middle and the left, are percentage of persons tested positive. You can see the run up there and the percentage of tests that are positive those are hospitalizations. On the top row, again, hospitalizations far left, the current hospitalizations really trending steeply upwards. And we'll see in a minute how it can really go out of control a little bit there. New hospital admissions on a day-to-day basis is still at a very high level. And then new positive cases on the top far right continuing to climb. Then on the bottom row, your percentage of persons testing positive on the far left, and at a lower level, but still concerning, over 5%, the percentage of the tests that are administered being positive. We're in good shape on the next chart with our personal protective equipment. Obviously a big concern of all our first responders, all our healthcare workers, and something, frankly, that we struggled with back in the spring that today we look in pretty good shape. So let's look at the hospitalization number. This is the biggest concern for all of us. Again, looking back in April on the far left of the graph, you can see the run up there till April 27th, I think, was the peak. It says here that, 337, this says April 17th, and we went from 167 on April the 9th to 337 on April the 17th. So over a 2-week period of time, maybe less than 2-week period of time, you ran up significantly to that peak and then gradually started reducing on the other side for the low of 29 at the end of August as we closed out the summer season. So this recent run up in hospitalizations, driven by activities going indoors, holidays, Labor Day activities into the Thanksgiving holiday, the run up in positive cases through October and November, and just see the acceleration from November the 2nd at 107 people hospitalized to December the 4th, where we had 306, and just in the last couple of days going from 306 to 338. So a very steep incline there over the last week, as we've been anticipating, and now we're seeing it. As a result of the run up in new positive cases and now hospitalizations, we've taken action to declare a stay-at-home advisory, which is just that. We're just saying we need to reduce the risk, given the prevalence of the COVID-19 virus among people circulating in our community, that you won't become exposed to it. And the way to do that is to wear a face covering, to keep socially distanced, and to avoid gatherings where you may come in contact unknowingly, both in terms of you not knowing someone else who's shedding the virus, as well as that person who may not be symptomatic and doesn't know that they are carrying the virus and might be putting you at risk. And so we all need to be careful. We all need to really lean into wearing masks, keeping socially distanced, and staying at home, and reducing the number of trips that you take, as we said back in the spring, into public places, whatever they might be, retail establishments, places where people gathering, bars and restaurants, and we'll be limiting, and as we have, the limits of those. We're trying to strike the balance there, right? Because we have to preserve public health, and we have to preserve a viable economy. And so that's what we're trying to do with all of these restrictions. We're asking all Delawareans to be advised to avoid gathering indoors with anyone that's outside of your household. So if that person next to you is not your wife or your son or your daughter, then you ought to be wearing a mask even in your own home. And certainly when you're out in public, you should be wearing a mask. And as I go around to public places, both outside and indoors, I see most people wearing masks. And that's what we need to have. If you're going to mostly protecting others from you unknowingly carrying the virus, but also now the science tells us that you're protecting yourself as well in doing that. We've got to do something to reduce the spread, the acceleration of the spread that you're seeing in the numbers. And those hospitalization numbers are as real can be. They're there, they're present in the hospitals. It's not a hoax. This is real, and it's serious. The advisory to stay at home does not apply to Delawareans in workplaces, of course, traveling to and from places of work, and then, of course, seeking medical care. I mentioned a minute ago, we've got a universal indoor mask mandate. We have to ask you all to wear a mask anytime you're indoors or outside with anyone outside your immediate family. We just have to do this in order to reduce the spread and the prevalence in our community, and therefore the risk. And when you think about it, when we do that, we're protecting those hospital workers that are putting themselves at risk to treat the folks that are now coming into their hospital. And this is a serious concern. On the phone call the other day with our hospital team, and they're seeing challenges that their staff are encountering with the stress involved in treating all these folks coming in COVID-19 positive. And then when they go home to work, or when they go outside of the work and they see folks that aren't following the mask guidance, it's really disconcerting. So the recommendations for December 14th to January 11th, we did have a recommendation to our schools to transition to remote learning. Mostly, we would determine that schools are safe places. They're safe places because they're structured environments. They're safe places because teachers, educators, and principals are following the guidance they're getting from public health. The children and the teachers and educators are wearing masks. Fewer children are in the classrooms even when they're in-person instruction, because some percentage of them are doing remote learning. And so we know that there's not a lot of transmission within the school, but the school environments obviously are affected by what's happening in the community. And so we need to be careful about all of that. And so when you think about being careful in the community, enables us to make schools even safer and convince educators and parents that they're safe to return, as we'd like to do in January, to more in-person learning. So the last day we hope of remote learning will be on January the 11th, with return to hybrid instruction on Monday, January 11th. We really think this is an important time to take a step back, for everybody to get on the same page with respect to what the science is showing us, what the data is and the evidence in the schools. And we'll be working on that as well in terms of additional information at the more local level, using that in conjunction with what we're seeing countywide and statewide, so that we can communicate with everybody who needs to know the conditions in schools and those environments. What we do know is that it's much more difficult for the children to learn in the remote setting, and everybody kind of agrees with that. The challenge is figuring out how to convince everybody that schools are safe places, and to do it in a safe way, and to make sure that we have the information and the data to back all of that up. So we do have $1 million that we've set aside from our COVID support fund from the federal government for our first responders, volunteer fire companies in Kent and Sussex County. You probably know that resources were made available by the COVID-19 resources that came from the federal government for Newcastle County. So we're making additional resources available in Kent and Sussex as well. The returns that we've gotten and the support that we've been able to make through the COVID-19 relief funds coming from the federal government, again, all our appreciation to our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester, all the members of the Congress on both sides of the aisle. We appreciate these resources that have been made available. The majority of a good number of these resources, closing in on $150 million, has gone to small businesses, and in particular the hardest hit small businesses, which are in the hospitality area and personal care area. So already, so far, we've had over 2,500 grants that have been approved. Over $110 million of grants have been approved as part of that, and with an $82 million base the first time around, if you will, and then this second increment to cover some of the restrictions that we just recently put in place, another $28 million in what we've been referring to as bonuses. The report we get from the Division of Small Business, which, by the way, Damian DeStefano and his team have been doing an outstanding job in helping businesses get access to these resources. $40 million plus has gone to restaurants alone. Again, these are among the hardest hit small businesses across our state, really important places. And so if you need to go and get a takeout order tonight or tomorrow night or in the days to get ahead, please go to your favorite restaurant and help them keep alive with revenue from your purchases. More than half of the grants approved have gone to businesses with fewer than 5 employees. Let me say that again, more than half of those grants, more than half of the 2,500 grants have gone to businesses with fewer than 5 employees, so very small businesses. More than a third have gone to women-owned businesses, and more than 25% have gone to minority-owned businesses, so some good distribution there as well. Also want to point out that we've been able to purchase and distribute in partnership with schools and school districts over 25,000 devices, enabling families and students to connect for their remote learning. Almost 24,000 devices requested under this program, and over 2,100 have added from existing Department of Education initiatives. So really a lot of good support going out there, both for students in remote learning as well as our small businesses with the COVID-19 relief funds. We ask everybody to celebrate Hanukkah and then the Christmas season after that safely. Hanukkah from December the 10th to the 18th. Wear a mask and spread the light, but don't spread COVID-19. If you find yourself uninsured due to COVID-19, we have affordable replacement coverages available through December the 15th. Get covered at healthcare.gov. And just lastly, and I alluded to it a little bit, we really want to have a really strong shout out and thank you to our healthcare workers in our hospitals in particular, and our long-term care workers in those facilities that take care of our elderly citizens and loved ones. These men and women have been doing an incredible job under very stressful circumstances, treating the most vulnerable, caring for the most vulnerable, saving lives, putting themselves at risk, and at times feeling demoralized by the inability of the rest of us to crush the spread and push the virus down. So if you have a family member who's a healthcare provider and a worker in a long-term care facility, if you have a friend, say thank you to each of them for the tremendous work that they're doing. And we can all help out. We can thank them most of all by wearing a face covering in public, by following the restrictions, by crushing the spread, and by doing what's necessary to keep our vulnerable population safe and to keep them out of the hospitals. We need you to really lean into that. A vaccine is coming. There's help on the way. The cavalry's right on the horizon carrying those vaccines, but we need to get, it's going to take several months to get it. We'll have within a week or so thousands of doses that we'll be able to distribute to those populations that Dr. Rattay is going to talk about in a minute. But in the meantime, we need to lean into the effort to prevent the spread given the prevalence of COVID-19 in the state of Delaware. Again, thank you all for joining in today. Now we have Dr. Rattay, who's going to talk a little bit about vaccines and distribution, is going to talk about CDC guidelines around quarantining. And Dr. Rattay, again, I want to thank you and your team for your tremendous work in all of this.
Thank you so much, Governor. So I want to start with, as I often do in these briefings, areas of concerns in the state. And if I used the criteria that I started out using in August, September, all of the state would be lit up. In fact, as I mentioned a few weeks ago, I changed the criteria a little, and still all of the state would light up. In other words, we have significant spread of infection across the state of Delaware right now. So there's no area in the state of which we're not concerned. That being said, our data are suggesting some stabilization in Sussex County at this point. So there's some increases in some zip codes in Sussex County, but in general, case rates, percent positivity, and hospitalization rates appear to be more stable in Sussex County. In Newcastle County, we're seeing increases in a number of the zip codes that we have been paying attention to: Wilmington, Newcastle, Delaware City, and Newark. But where we're most concerned, and where I would consider the hottest spot of Delaware right now, is below the canal. So Middletown, Townsend, Smyrna, Clayton, Hartley, Marydale, Dover, Magnolia, Viola are all elevated and significantly increased over the past couple of weeks. So I've pointed it out. I've pointed out Kent County and Southern Newcastle County over the past few briefings, but we're definitely seeing some significant increases. Highest percent positivity, highest increase in hospitalizations are in Kent County. We also had 6 deaths in Kent County yesterday, which is quite notable. So although the case rates might not look that high in Kent County, that's really because testing isn't There's not as much participation in testing. And as the governor's often said, hospitalization is where you really know what you're seeing on the ground. And so our plea to those in Kent County is please participate in social distancing and not gathering and face coverings, and please get tested. So let's shift to some of the better news going on right now, which is vaccines and the vaccine update, which we are really excited about some updates that we have to talk about today. So on the next slide, let me talk about some of what's going on at the federal level, which is on Thursday, the FDA is reviewing the Pfizer application. And on Friday, the committee that we refer to as ACIP will be reviewing what comes out of FDA. So we are expecting to see an emergency use authorization and emergency approval from FDA for the Pfizer vaccine later this week, which we're very excited about. We've already put forth our order for as much vaccine as we can get of the Pfizer vaccine. We're expecting somewhere around December 15th. And as you've seen, these dates and the numbers change, but we're expecting about 8,775 doses of the Pfizer vaccine around December 15th, which again is really excited. We also know that the Moderna vaccine is also soon to be going through that same FDA approval process. And we'll be expecting, right now we're hearing 8,300 doses of the Moderna vaccine, perhaps the following week. So as the governor says, the cavalry is on the horizon, and we are soon expecting vaccine in Delaware. And we've been doing a lot to prepare for this. We have recently centralized a number of people focusing on the operations and the logistics around vaccine at our warehouse, and really have ramped up our efforts to receive and disseminate vaccine. We also have done something which is with the federal government, we did a test of ordering our vaccine the other day, and we call that end-to-end testing, and everything went very smoothly. So that shows that the process is all in place for us to order and receive our shipment of vaccine here in Delaware, hopefully next week. Another exciting thing for us, you may be surprised about the things we get excited about in public health, but we received our ultra cold storage units this morning at our warehouse, which might look just like a basic but skinny refrigerator, but it is an ultra cold freezer, so it can store the Pfizer vaccine. And in fact, it can store almost 300,000 doses of the Pfizer vaccine. So again, this is an important piece of our ability to receive and store vaccine and get it out to our partners. So next, I want to talk about the allocation of the vaccine. And Dr. Hong went into this in a lot of detail last week, and Dr. Hong has been doing a lot of work on this front. Certainly, we've been paying a lot of attention to the federal ACIP recommendations, but our ethics committee is meeting regularly. They met this morning and agreed with the ACIP recommendations for phase 1A, which is that the vaccine should go to healthcare workers, long-term care workers, and residents, as well as first responders who provide frontline care to potential COVID patients. So the vaccine, when it first gets here, we have been working with our hospitals and are prepared to get it out to Delaware hospitals, where they will begin vaccinating right away their highest risk workers, which includes like those who are providing care for COVID patients, those in the emergency departments, not just doctors and nurses, but those who are interacting with individuals who have COVID or most likely to have COVID. Same with the first responders. We're working closely with the county paramedics in all 3 counties to get vaccine into the arms of our paramedics. We just activated the federal pharmacy program, which enables pharmacists to go into long-term care facilities to vaccinate residents and workers. So those are the first phases of 1A, and we're really looking forward to getting to the vaccine into that group. The 1B is a phase of which there's more work to do. ACIP is not finalized phase 1B and how that group gets sequenced. And our ethics group is also having discussions around this. But from our perspective, where we are right now, we really want to see vaccine getting to essential workers, those on the front line, whether it's poultry plant workers or educators like K through 12 or childcare providers, also those at high risk of more serious consequences. So those who are older, those with chronic underlying conditions, including individuals with disabilities. So again, that's what we're looking at for 1B. Hopefully we'll be able to actually start vaccinating the group in 1B in about 3 or 4 weeks or so. So that's not too far off, but we will certainly keep you all updated as we get more definition and agreement as to how we will be rolling that phase out. So let me move on to the next slide now, which is really just a reminder that we have a lot of good resources on our coronavirus webpage under our vaccine tab. Information for public. We really want to continue to remind people that what we're finding so far from this vaccine is that it is safe, and it also is, as I've mentioned before, more effective than we even expected it to be, which is super exciting. And we know that we have a number of our 1A group, healthcare providers and paramedics and others who are excited to step up and get the vaccine to protect themselves and the others that they serve. So again, keep your eyes on our COVID vaccine page so you can get more information as we go forward. Let me shift gears a little bit. I want to talk to the updates to the quarantine guidelines. Many people noticed last week that on Tuesday, the Centers for Disease Control and Prevention came out with some updated guidance for those who are close contacts. So not for people who have COVID, but for those who are contacts of people with COVID. And they say that although we've had the 14-day quarantine for some time because that was the known or likely incubation period for COVID, more science has really led CDC and us to conclude that other options are also good options for quarantine, and also options that can make it easier for people to be able to complete quarantine safely and to get back to work or get back to the real world. So let me talk a little bit more in more detail. The current protocol, again, is a 14-day quarantine, and that 14-day quarantine, is really the incubation period is potentially 14 days, but what we now know is that it's very rare to become positive after day 10. In fact, the CDC is suggesting that very few people, in fact, maybe 1%, are going to become positive after 10 days. And additionally, the 14-day quarantine right now, it may cast a wide net and keep people away from exposing others, but it also is a high burden on individuals and society, keeping people out of work for a 14-day period. And it also doesn't really promote people getting tested. And so the 10-day quarantine, we feel, is an appropriate option. The risk that you may miss, you may leave quarantine before becoming positive is approximately 1%. Now, the range could be between 1 and 10%, but most likely, very, very few people are going to become positive after 10 days. We like the 7-day quarantine approach as well, which says if you get a test and it's negative on day 5, 6, or 7 of your quarantine, then that's also another approach where you can essentially exit quarantine on day 8. Now, a couple of caveats there. One is that it's depends what test you get. So PCR test is okay at day 5. Our preference with the rapid test that's now becoming more available is that people do that on day 7. And if everything's fine, then by day 8, they can exit quarantine. And when I say everything's fine, that means negative test. And for either 10-day or 7-day, you must not have symptoms. Additionally, on the next slide, we really highlight the importance of if you leave quarantine before 14 days, so at 7 or 10 days, it's really critically important that you continue to monitor for symptoms and strictly adhere to wearing a face covering at all times and social distancing from others for that full 14-day. A couple other things I want to mention as we transition to this new system. Of course, we'd love to snap our fingers and make it happen, but there are a few pieces to this that we are working to put in place. So we're working to set up a center where people can either email us or call us to get us the information about their test or about their quarantine days so that they can clear at 7 or 10 days. That's not in place yet. We expect for that to be in place early next week. And additionally, we're making changes to our contact tracing system, but until towards the end of the year, anyone who is a contact will continue to hear the guidance to quarantine for 14 days. We do recommend waiting till our system changes are all complete. But if there are particular reasons, so for example, a healthcare site that wants to clear somebody using the new guidance, they can go ahead and clear. We do not require DPH clearance for people to be able to go back to work. And finally, I do just want to mention that there are some settings in which it may be preferred to stick with the 14 days where risk of spread is higher. So for example, in long-term care settings may choose to stick with the 14-day quarantine, especially with residents, because spread across individuals there can obviously have devastating consequences, as we have seen. And so with that, I'm going to hand it back to you, Governor. Thank you.
Thank you very much, Dr. Rattay. Really good information there. Help is on the way with respect to the vaccines. Really great work around figuring out how to distribute the vaccine. We got our super cold freezer, so we're ready to go. And thousands of doses can be stored in that freezer, as I understand it. And still a lot of work left to go with respect to additional populations. And I know you're getting a lot of inquiries about that and responding appropriately. It is a very transparent process, a process with a lot of public input that starts with the federal ACIP, and flows through the local decision-making process here. So we're really looking forward to it. It's really extraordinary to have it this soon. And it's safe and effective. AJ's been working hard on our testing, so hard that we're blowing out our numbers and the ability for our provider to provide results in a more timely basis, and so have to try to figure out a way to strike a balance there, AJ, with respect to number of tests and turnaround time on the test results, which we know is a critical part of it. So AJ, thanks very much for being with us and for the work of your great team.
No, absolutely, sir, and thank you, and good afternoon, everybody. And the governor, I think, teed this up well. You know, we're at a line now where we want to balance to get as much quantity as we can in testing, but also have a quality result to get it back to the individual to make sure if they are positive, they're able to isolate, contact anybody that's been a close exposure, et cetera. So we're working on that. We want to get as much testing out there, but we also want to make sure we don't get to the time where it doesn't make it fruitful for the individual that got tested. So again, this week we have over 30 sites. We'll start looking at, we have in Newcastle County, 16 sites in Newcastle County this week. I do have to identify, we did have one mistake on the Newcastle County flyer. The Victory Church that was scheduled for tomorrow was a misprint that we took it down. It's off the sites, but if you see this flyer, there is no testing there tomorrow. So 16 sites in Newcastle County between Monday and Saturday. Again, thank you to our partners at Newcastle County who's facilitating some of the drive-throughs as well here several days a week. As we go down the state, in Kent County, we have 5 this week, all trailer-based. We can do up to 1,000 people a day. We are still not turning people away from sites. So I don't want to, by our opening comments, to think that we're not testing people, but we want to make sure we are being more strategic and positioning them where they need to be so we could get the testing in the communities where public health identifies. And then down in Sussex, a few more sites, but however, the geography down there is a little bit different in the landscape. So we have 12 sites in Sussex County for this week. All this could be found, as you know, at de.gov/get-tested. We put these PDFs out, early in the weekend so people know where it will be the following week. We will make changes. We'll add sites. We may have to change some sites or hours or due to weather. If you go to de.gov/get-tested, that is the most updated information. You can also follow the Delaware Division of Public Health website, as well as DEMA Facebook page for additional information as well. So we know Hanukkah is right around the corner. We have the holidays. We have the New Year. We know it's going to be a busy time. I talked a few weeks ago about the spike of increasing we saw prior to Thanksgiving. We went from averaging 6,000 to 7,000 tests a day to a week where we did 13,000, then 2 concurrent days of 10,000. So we have worked with our provider, the other lab Vault that does the at-home testing, and we are ready to ramp this up as well. This is a convenient, very easy process for individuals to do in your home. You need 3 things. You need to live or work in Delaware. You need to have an email address per individual that's going to get tested, because you can only register 1 test per an email address at one time. And lastly, you need a smartphone or a tablet to do the Zoom connection with the nurse or a medical professional that's going to observe you do the test. Right now, these turnaround times, we say 48 to 72 hours, but we know from the time it gets to the lab, and we've tracked this and we've had a lot of great examples. It gets delivered up to the lab in New Jersey, usually between 10 or 11 a.m. in the morning because it goes UPS overnight. Those results are being reported out before the next day at 10 o'clock in the morning. So right now we have a 24-hour turnaround time from the time it's received in the lab for Vault. So please, this is perfect. If your kids are coming home from school or something else is going, or we know we want everybody to be smarter about the stay-at-home guidance, but this is something where you could order it, do the test online, mail it back in, and almost to the hour know when you're going to get your results back. So that's one option. Curative and Walgreens. Curative, if you remember a few weeks ago, I was excited to say we had our average turnaround time to 24 hours. Because of the volume increase, we're up to about 50 hours right now. Some are turning around much faster. We have a courier service that's getting a lot of them down to DC the same day. Others are still being UPS for some of the smaller sites. We're seeing about that 50 to 60 hour time frame in the beginning of the week. Then we kind of lower down. They're able to clear the queues out, and it might increase a little bit as we get to the weekend. So Walgreens, which all those tests are run at the Division of Public Health Lab, they're still around the 48 to 72 hours as well. So there are options. We are seeing a little bit far longer lag in turnaround time, but we will work with our partners to make sure we diversify as much as possible and get that down. So we hope everybody has a safe holiday. We will have testing throughout the month of December, and please check out de.gov/get-tested to see what's convenient for you. So, Governor, back to you.
Yeah, thank you very much, AJ. Thank you for your team. Just an unbelievable effort to get up over 100,000 tests. We do need to see, as Dr. Rattay said, more testing in Kent County. AJ had the report there Monday in Smyrna, Bethel AME, Tuesday, Camden, Wyoming Fire Company, Thursday at Whatcoat UMC Church in Dover, Friday at Harrington Fire Company, and Saturday at Mount Zion AME and Dover. Really need to get testing there in Kent County. We're seeing increased spread and prevalence. We're seeing increased hospitalizations. Those are real numbers in the hospital, and you need to know your COVID-19 status. So get tested. There are lots of opportunities to do that statewide. We're really doing an excellent job of that with the increased prevalence across our state. It's more important than ever that you know your status, and so take advantage of the opportunity to get tested in each of the counties. I mentioned earlier at the top about the COVID Alert DE app. Think about downloading it. It's a completely voluntary and anonymous, but it is a great tool to help you if you run into somebody and you're within 6 feet of somebody who tests positive and is participating as well anonymously, and gives public health the go-ahead to alert anybody who's been within 6 feet of them for 15 minutes. It is a good little tool, particularly when there's so much virus being spread across our community. We still need you to fight the flu and get your flu shot, so don't forget about that. flu.delaware.gov. Lots of information there for that, and important as we try to fight both the flu and COVID-19. So let's come together as a community. We've got help on the way with the vaccines. We've got great work going on with the distribution of the vaccine from the companies to the federal government, to the states and localities, to hospitals and first responders, and those that will administer the vaccine. They're safe, they're effective, and they're going to get us back to life as we know it before COVID-19. It's still months away, and so we really need to lean in there. We need to lean in there for our first responders. We need to lean in there and respect and value our hospital workers. We need to lean in there and support our teachers and our children that need to be educated, and everybody needs to do their part. So thanks for joining us today. I know we have a number of pre-submitted questions, and we have people on the line with questions as well. So I know you've been informed about how to get in line, and we'll look forward to your questions.
Governor, first we have Amy Cherry from WDEL. Amy, you can unmute.
Hi, Governor. Thanks so much for taking the time here. I wondered if you or Dr. Rattay might be able to shed some more light about how long people are in the hospital and how serious they are. I realize we have 41 in critical condition, but just maybe a little more data on who's being hospitalized and how serious.
I'll turn it over to Dr. Rattay. I'll just provide the information that was provided to us from the hospitals, and it's really generalizations. There are obviously people that are very sick because we've had fatalities, but compared to the situation in the spring, they have better treatments. Dr. Rattay might comment on that. And they're saying that still serious illness, but maybe not as seriousness across the board as in the spring. And the demographic seems to be, reflective of the population at large, without, one demographic or another being overrepresented.
Yeah, so I'll just add to that, but not a lot. I mean, what we are seeing during this phase of or this surge is less people are requiring placement in the ICU. Less people are requiring a ventilator. And actually, I think this is great news in the midst of all of this. If you look at the curves that the governor showed, certainly around cases, they're increasing significantly, as are hospitalizations, but our death curve is much more level in comparison. And so what we are seeing is that we're not seeing as many people who are as ill, who are requiring the ICU, who are requiring a ventilator, and who are passing away. Nonetheless, we still have far too many people who are too sick and who are succumbing to this illness than is acceptable to us. As the governor mentioned, there are some advances in treatment, certainly in comparison to when we started. So there's several FDA approved treatments now that can be used early on in the course of illness for somebody. And so we've been working with the hospitals on getting that out and getting that to patients, such as monoclonal antibody treatments. There's 2 types that we now have in the state. And also there was certainly some great strides learned about the benefits of steroids through the research over the summer and in the fall. So with those and other treatment options, people are doing better. But again, far too many people are getting too ill from this virus still.
Thank you.
You're welcome.
Next, we have Nick Ciolino from Delaware Public Media.
How's it going, Governor Carney? I wanted to follow up on a question I had pre-submitted a couple weeks ago. I had asked whether you felt that there was evidence that government restrictions had been effective in preventing the spread of the virus, and you referenced a chart showing the trend line of cases in Delaware. And I wanted to take the opportunity this week to push back a little bit and ask whether or not the state implementing its lockdowns a month before that we saw a decline in cases, and given the fact that we seem to be on a similar trend line with other states, despite varying levels of restrictions in different states. For example, California and Texas are each on a similar trend line. And I would ask today that is there evidence in the data that shows that there's causality and that the restrictive measures are effective at mitigating the damages caused by the virus? And can we demonstrate that in a way that would justify not only the cost to small businesses, but also the other public health concerns that have gone hand in hand with restrictions?
Yeah, really great question. And determining cause and effect in the middle of a pandemic is obviously very difficult. You can see the correlation, and you probably understand what that means. If you look at and particularly compare states like Delaware, like Maryland, like Pennsylvania, New Jersey, New York, New England, and Texas, Arizona, Georgia, Florida, and others, and just compare the experience of the spring. We followed CDC guidance. First of all, it starts with CDC guidance and recommendations, which was 14 days, intervals of 14 days improvements. And we did that. They didn't do it in those other states. And instead of seeing a crest in their number of cases and hospitalizations, they had a little bit of a crest and then another acceleration. So can we draw cause and effect? That's not the business that I'm in. It's my job as governor to look at the science as presented by those experts and say, here's what we should do to protect the health and safety and welfare of Delawareans. And that's what we've done. This time around, we've tried to be more targeted and try to do exactly kind of what you're, I think, suggesting or alluding to, and that is to try to actually identify the things that are going to be result in the effect that we want. And that's much more difficult to do. We have been much more targeted. We know more about it. And one of the things that we know are some of the places where transmission occurs outside of these controlled environments are where transmission occurs, and that makes it difficult. So very strong stay-at-home advisory, cautionary for everybody. Don't circulate in large gatherings in or outside. Wear face coverings, everybody, from Dr. Fauci all the way through, even to governors who previously kind of ignored the evidence of of face wearing. And I would just bring your attention to some very prominent national examples of that as to what works and what doesn't.
And then one other question, in respect to those targeted responses, you mentioned earlier that there was increasing concern in Kent County. Does more need to be done there as far as testing, and is there concern about Bay Health and its capacity?
Yeah, yes and yes. We're going to try to do more. Obviously, we've made a commitment. One of the reasons for this pause that we've recommended in conjunction with the holiday season for schools is to look at all our data and how we can use it to be more specific and more general and bring that to bear in making decisions there. So yes, to finding, and we're constantly trying to figure out how to use the data to drive decision making. And then with respect to Bay Health, absolutely, we've seen, and I was on the phone over the weekend and yesterday with Terry Murphy. He's got his team, they're ready to go, they're on the ground working at ways to manage that population in their facilities. They've got a brand new facility there that they can light up some portions of it to help with this surge capacity. We are working with them. AJ, I put in charge of a task force to work with the hospitals and look at this surge capacity issues, help us understand how they are going to manage that, whether it's in Kent County, Sussex County, or Newcastle County. Each of them are very different and have very different capabilities. We have an agreement now with Genesis to take off patients being released from hospitals, and I know Bay Health has released a number of those patients to the Genesis facility in Milford there, so that opens up space for others that may be admitted to the hospital. So yeah, we're very concerned about that. If there's a message today, we ought to be concerned about that, and we ought to be taking our individual efforts to protect that hospital capacity, to protect our ability to treat COVID-19 patients, and to protect the nurses and the physicians and the healthcare workers and the nursing home workers that work on a day-to-day basis with these populations. Dr. Rattay, anything to add to that?
No, I think you answered it perfectly.
All right, next we have Sarah Gamard from the News Journal. Sarah, you can unmute.
Hey, Governor, can you hear me?
Yes, Sarah, go ahead.
Governor, can you provide a specific data point in terms of COVID-19 spread as to which you would shut down indoor dining again?
The answer is no, not a specific data point. We look at all of the data. This hospitalization number is probably the most important. And I know I've been asked maybe last week or the week before, at what number do you do things like shutting everything down? Again, our approach is going to be to find a more targeted way. I don't know that we have as much the ability to do that to enable businesses to survive, and we can't kill the patient with the therapy here. And we know where this transmission is occurring, and we know what people have to do. It's our challenge to get folks to do it.
Considering that hospital capacity has hit a record today, does the National Guard plan to stand up any hospitals like it did at Nemours and at other venues? And when is the timeline for when that will happen?
Yeah, we've looked at that. As I think I said in our last week, we have an arrangement with Nemours to do that. We have National Guard folks that would help us with that. I'm going to ask AJ in a minute to talk about that. But what we've heard two things, I think, from the hospitals. Help us manage our own facilities by enabling them to release patients that no longer need to be in the hospital, whether that's somebody that needs to return to an assisted living facility that's not COVID-19 positive, or whether it's somebody that's in the hospital for a different reason that might be able to be released a little bit too early. The limiting factor, as we've heard from them constantly, and it goes to this question of staff that has to be quarantined because they've come in contact with somebody who tests positive. So they go on the bench when that happens. They can't go to work. And so that limits the staffing levels that they have in the hospitals. At the same time, it does the same thing. We've talked about this with operationally with respect to schools, with teachers who have a similar situation. And so the issue isn't so much facilities. It's not beds as much and rooms, certainly not ventilators as we expected in the spring. It's staffing and the availability of staffing. And so if you don't have the staffing, it doesn't matter if you have a facility like the one that we were prepared to stand up at Nemours, or a facility that's, you know, there in the existing building, like the space that Bay Health has down there in Milford. And so that's the challenge. AJ, would you like to comment more and how you see it and how your partners see it there?
Yeah, so I think, you know, Sarah, again, a good question, and it's a, you know, it's the limiting factor is staffing. And so if we look at the Guard, we know the National Guard has some great men and women that we could tap into and put on state active duty. However, we want to go a little bit more micro. We don't want to be robbing Peter to pay Paul. We don't want to be taking somebody out of a clinic, an emergency room, or a hospital right now as a civilian and put them on order. So, you know, that dwindles our number down a little bit, but there is a core team there that we are willing to activate when needed. We have and will have ongoing discussions with Nemours that could provide some flexibility to our hospitals in Northern Delaware. We have a meeting this afternoon with Bay Health to discuss some of the options for their campus down in Sussex, so that has some flex space that the governor mentioned to a minute ago. And then again, talk to our other partners in Sussex County. So it's not a one size fits all response. We've seen other larger urban areas, you know, take a convention center or something like that and set up, you know, 100, 200 beds. Well, there's a lot of staffing, you know, that's probably 50 nurses, you know, a dozen doctors, a lot of support staff. So that's why we're working with the hospitals to say, what do you need? What can we help you? What solutions can we help you find within your walls to make it through the surge?
And if I could, Sarah, just to put a clarifying point on the observation about our National Guard men and women who have healthcare expertise. Remember, they have a day job, and we might be taking them away from that clinic or that placement, their normal employment, activating them to help with the surge capacity. So we're taking, to use AJ's terminology, we're borrowing from Peter to pay Paul, right? We're not getting an additional impact there.
All right, next we have Sean Green from WDEL. Sean, you can unmute. Sean, you're still muted.
Let's try clicking that button. Governor, there's a petition circulating to let winter athletes play games. It claims depression, anxiety, and suicide among adolescents are rising at alarming rates. Does DPH have any data to whether this is actually happening in Delaware? And what is the state doing to support people facing those challenges?
I'll defer to Dr. Rattay on the data that we have around those challenges.
Yeah, I will say I don't know of any data that are suggesting that students who can't compete in winter sports are leading to, you know, those serious of adverse events like suicide. But we know that there's tremendous benefits of physical activity in youth sports for youth. But we also know that the winter sports are indoors, and two of the most popular winter sports, wrestling and basketball, certainly there's risk because they're such high contact. So we did not want to stop practicing for these teams. We wanted youth to be able to continue to be physically active and to practice their skills and development, which is certainly very good for mental health. But there is increased risk of competition because you're adding or you're increasing the number of contacts that people are close to. And so while we're pausing with many things right now, we think that pausing on for competition makes a lot of sense.
Next, we have Tim Mastro from Delaware State News. Tim, you can unmute.
Good afternoon, Governor.
Hey, Tim.
I have two questions, both about testing. First one, kind of follow up on what AJ mentioned. As we all saw, there was high demand for tests around Thanksgiving, the weeks, kind of the days before and the week after. I know you were really pushing the at-home test, but I'm curious what the state learned from that week and how's that going to affect kind of the pop-up sites and community testing events around Christmas and the holiday season?
So I think that there's a lot that we learned, and I think we learned, the first thing is people want to get tested. So that's the win right there. But I think we learned we need to have longer hours. So we want to make sure we have times where people can get tested, after that, 5, 6 o'clock mark, so they could get tested in the early evening. Saturday testing is important. We don't do Sunday, and that's more or less to relax the lab. It's a good catch-up day for the lab capacity. And I think, our messaging is going to be those events are Thanksgiving's a week, Hanukkah starts in two days. Then, we get into the holiday season. So we have a little bit more time there. So I think you're going to see just as many events spread out in our messaging that, get tested, know your status, all that stuff. So, unfortunately there's, we are pushing the at-home test to utilize that lab volume and that convenience for the individuals. But when it comes to the, curative options we have, we are, already kind of maxed out on our capacity. So I don't think you're going to see more sites. I think you're going to see longer hours, maybe some more strategic locations in rural areas where we're not getting the testing we need. But, we're still testing and, going to do it through the December. So no stopping us.
Gotcha. And are you anticipating kind of a rise in turnaround time with the holidays, not only because of the increased demand, but do any of the labs might have a shortage of employees because of time off due to holidays?
So the labs have, it's specifically curative, where we're sending approximately probably about 80% of the tests right now in the state. They're working 24/7, holiday or not holiday. They have people working all Thanksgiving weekend. So we do have that agreement with them. It's working. The demand is going to be what causes the rising turnaround time. We'll see this week how yesterday we had about 9,000 people, so a little bit less than we did a week ago Monday. Today looks like we'll probably end up between 7,000 and 8,000. Again, about 1,000 lower than last week. So, I think it's that, we're just about 2 weeks back from Thanksgiving right now. We're going to see a little decline. So if that happens nationally, I think, we'll be back under that 48-hour mark. But if we stay at that 7,000 to 10,000 per day, we're probably within the 48 to 60-hour turnaround time for the duration of this spike in the winter.
All right, last we have Cassie Semyon from WBOC. Cassie, you can unmute.
Hi, Governor. Can you hear me?
Yes, Cassie, go ahead.
All right. So last week, Governor Carney, you said our current hospital bed capacity in the state sat between 400 and 500 beds. And I understand that this is a fluid situation. Do we know as of this week where our current bed capacity sits? And is there any discussion of stopping elective surgeries in the state to reserve beds? Or would that fall to the hospital systems themselves to make that decision?
Yeah, so this is a great question, and it's frankly fundamental to our approach right at this moment to really better understand those limitations. The worst case scenario we don't want, which is to be in a position where we're rationing a limited hospital capacity. And so we've engaged the hospitals. I think I said a while ago, they're very receptive to our assistance, and they have shared information about what's happening in their facilities. I've asked AJ to head a working group with their operational folks. We would prefer that they could manage their facilities. They know it already. They're starting to make determinations about what kind of procedures can wait a week or two or longer. It would be our preference for them to continue to manage that within some level of comfort that we and understanding that we develop together, and that we work on alternative care sites, as I mentioned earlier on, which might include additional space that Bay Health has identified there in their facility, space that's brand new, but they're not utilizing it at the moment. We talked about the agreement with Genesis, assisted beds outside of the hospitals to enable hospitals to release patients so they can admit patients on the other end. And so moving patients through the continuum, kind of from the emergency room or wherever, and then out towards some other placement, and maximizing the staffing that exists out there. And that could include the new guidance around quarantining, which would be a big help for some of those with minimal increased risk. So it's a number of things, and it starts with the hospitals themselves understanding the situation that they have with our help, knowing how to manage their individual facilities to move people in and then out, and then working together on alternative care sites. The limiting factor being mostly the availability of staffing, whether it's bedside nursing or caretakers or physicians to oversee those activities. AJ, anything you want to add to that? Or Dr. Rattay?
Okay, so just before I ask my next question, just to clarify, we're not going to talk about what our actual bed capacity sits at right now. Like, we don't have a number at this point.
Well, you were exactly right when you said it's a fluid situation, and the number really changes from day to day, depending on who else is in the hospital and for what reason, right? And is there a place, an alternative care setting that they could be moved into or not admitted in the first place? All of those kinds of questions. Do they have staffing, even if they have the available beds, et cetera, et cetera?
Okay, and then last week, I believe it was Amy Cherry asked you about the DSEA's statement asking for more COVID data transparency, and you answered her question by saying that the state had been very transparent with that data with the school districts. And then in an announcement, you said that we would see a change to the data dashboard to provide more relevant public health conditions affecting the schools. So what exactly do those changes look like? And will that just be for the schools, or will the entire public have access to this change data platform?
No, I think what I said was that we believe that schools are safe places. And it's hard to make that determination with statewide data, for instance. And we have conversations with district superintendents and personnel who know and can know, unlike even us or the Division of Public Health, individuals who've tested positive that work in their facilities. And so what I said was that we would work with all the stakeholders, the people that have to go to work in the schools to educate the children, teachers, staff, paraprofessionals, anybody that has to be in there for the operation of a school, to understand what the conditions are more generally, and if to the extent that we can develop more information locally that can help with their understanding of the situation in their school and their school district. Some of that information is publicly available, and some of it isn't. Some of it is just available to school personnel to make decisions that affect the health and welfare of their employees. Dr. Rattay may have an explanation of exactly how that works, because there's information that employer can have, as I understand it, that maybe even the Division of Public Health is not knowing the specificity of those employees.
Yeah, I'll just say we're working hard looking at how other states have presented data that provides more detail around potential or likely spread in the school setting. We're also even looking at, to see if there's any model approaches that Europe has taken. So it's not as though, we're sitting on data that we're not making available. but we really are trying to get more information to be transparent, to tell the story about what is going on in the school setting. So that's something that we're really working hard on right now, so that we know that people want more information. And so we're trying to find what's the best way to do that. Do we have the data already? Do we have to find different ways to get that information and to make it available? That's really what we're looking at right now.
All right, this is the last question we have time for. This was pre-submitted from Mallory Metzner at WRDE. Yes, Dr. Fauci has said that kids are safe in school, yet you are recommending Delaware schools go fully remote. Is the governor basing his recommendation off of different data than Dr. Fauci? And if so, what are the differences?
Yeah, no, actually, Dr. Fauci's analysis there has been part of our analysis and conclusion that schools are safe places. What we've been saying is that we need to get a broader understanding. First of all, use the holiday season break that's coming anyway, and add a week on the front end and a week on the back end, given the fact that we do have concerning spread in the community, and reach a better understanding within the school community and the larger community about the safety of schools. Dr. Fauci would also say, as I understand it, if it was up to him, he would close all bars and open all schools. And we accept that rationale, but we want to try to be measured in our targeted approach to keeping a healthy economy. That's not to say that we want to keep bars open at the risk of children being in school. Not that at all. I think Dr. Fauci says that because he believes, and the evidence is there, that schools are safe places. As we've said, children need to be educated. They need to have the social interaction that schools offer, and all the other things. The previous question about anxiety and depression among students, high school students aren't able to have their athletic opportunities, and just reaching a better understanding with all the stakeholders involved in the enterprise. And so that's why we've recommended the approach that we're taking, and we certainly appreciate the advice we get from the professionals, both at CDC and NIH. So Dr. Rattay, would you like to comment further on that?
No, I think that you really captured that well. I mean, we in public health didn't make the recommendation to go remote based on the spread in the schools. And as we saw, a number of European countries have surpassed their peak while keeping schools open and taking other measured approaches. And so for all the reasons that Governor Carney just stated, it's important for us to do everything we can to help kids stay in school, but we know that the high volume of cases has operationally been very challenging for some of the schools. So we agree with Dr. Fauci, and we're going to continue to work with schools to ensure safe learning for kids in the new year.
Thank you, Dr. Rattay. I think that was the last question, a pre-submitted one. We appreciate all the media has joined on this Zoom call, and I want to thank everyone who's tuned in again for our weekly press conference, and just underscore the importance of the discussion that we've had today, the concern that we have over the rising hospitalizations of COVID-19 patients here in our state are reaching an alarming level. We need to do everything that we can to reduce the prevalence and the increase in that prevalence across our state, to reduce the risk of exposure to every Delawarean. And we're asking everybody through our stay-at-home advisory to wear a mask inside and outside when there's no one in your household present, to abide by the restrictions that will take effect on the 14th and those that have taken effect already. We need to lean into this. We have help coming along the way. We've got light at the end of the tunnel with vaccines coming and being distributed to Delaware and states across the nation in the next several weeks. And we'll get thousands of those doses, I think, on a weekly basis and distribute them out to the priority list, starting with healthcare providers and first responders and educators and everybody that's doing that essential work across our economy. We appreciate your efforts over the last 9 months. We've got, again, light at the end of the tunnel, help along the way. And we just need to lean into these next several weeks through the holidays. Be careful, be cautious, think about your neighbor and think about your loved ones, and we'll get through this together. Thank you very much.